Lung cancer is a pervasive and potentially life-threatening disease that primarily originates from the lungs. It is one of the most common types of cancer, affecting both men and women globally. This video aims to provide a comprehensive understanding of lung cancer, covering its types, causes, symptoms, and available treatments. Types of lung cancer. Lung cancer is broadly categorized into two main types: non-small cell lung cancer, NSCLC, and small cell lung cancer, SCLC. Each type has distinct characteristics, including how the cancer cells appear under a microscope and how they behave. Non-small cell lung cancer, NSCLC. NSCLC accounts for approximately 85% of all lung cancer cases and is further divided into several subtypes. Adenocarcinoma. This is the most common subtype, often found in the outer areas of the lung. It is frequently diagnosed in non-smokers and tends to grow more slowly than other types. Squamous cell carcinoma. Typically found in the central part of the lungs, squamous cell carcinoma is often linked to a history of smoking. Large cell carcinoma. This is a less common subtype that can occur in any part of the lung. Large cell carcinomas tend to grow and spread more quickly than other NSCLC subtypes. Small cell lung cancer, SCLC. Small cell lung cancer is less common, comprising about 15% of lung cancer cases. It is characterized by small, oat-shaped cells and is known for its aggressive nature. Small cell lung cancer is strongly associated with cigarette smoking. Causes and risk factors of lung cancer. The primary cause of lung cancer is cigarette smoking, which is responsible for the majority of cases. Tobacco smoke contains numerous carcinogens, such as benzene, formaldehyde, and polycyclic aromatic hydrocarbons, which damage lung cells and can lead to the development of cancerous cells. Other significant causes and contributing factors include second-hand smoke, passive smoking. Exposure to smoke from other people's cigarettes, pipes, or cigars increases the risk of lung cancer among non-smokers. Second-hand smoke contains many of the same carcinogens found in directly inhaled smoke. Occupational exposures. Certain occupations involve exposure to carcinogens that can contribute to lung cancer. Asbestos exposure is strongly linked to lung cancer, particularly among individuals working in construction, shipbuilding, and asbestos mining. Radon gas. Radon is a naturally occurring radioactive gas that can seep into homes and buildings. Prolonged exposure to high levels of radon is a known risk factor for lung cancer, especially in areas with higher concentrations of this gas. Air pollution. Long-term exposure to high levels of air pollution, including particulate matter and various pollutants, has been associated with an increased risk of lung cancer. Genetic factors. While most cases of lung cancer are linked to environmental factors, there is evidence that genetic predisposition may play a role in some cases. Individuals with a family history of lung cancer may have a higher risk. Lung diseases. Pre-existing lung diseases, such as chronic obstructive pulmonary disease, COPD, and pulmonary fibrosis, can increase the risk of developing lung cancer. Inflammation and damage to lung tissue over time may contribute to the formation of cancerous cells. Personal history of cancer. Individuals with a history of lung cancer or other types of cancer are at an increased risk of developing lung cancer. Symptoms of lung cancer. Lung cancer symptoms can vary, and they may not manifest until the disease has progressed to an advanced stage. It's important to be vigilant about any persistent or worsening symptoms, especially for individuals with risk factors such as smoking or exposure to environmental carcinogens. Common symptoms of lung cancer include persistent cough, a chronic cough that lingers for weeks or becomes more severe, coughing up blood or rust-colored sputum, chest pain, constant chest pain that may worsen with coughing, laughing, or deep breathing, pain that extends to the shoulder or down the arm, shortness of breath, difficulty breathing or shortness of breath, even with minimal exertion, unexplained weight loss, significant and unintentional weight loss, fatigue, persistent fatigue and weakness, loss of appetite, a noticeable reduction in appetite, recurrent respiratory infections, frequent infections such as bronchitis or pneumonia, bone pain, pain in the back, hips, or other bones, which may indicate metastasis, Headache and neurological symptoms. Headaches, dizziness, or neurological symptoms if the cancer has spread to the brain. Swelling in the face or neck. Swelling in the face or neck, known as superior vena cava syndrome, caused by a blockage of blood flow. Diagnosis. The diagnosis of lung cancer typically involves a combination of medical history review, physical examination, imaging tests, and laboratory tests. Here's a step-by-step overview of the diagnostic process for lung cancer. Medical history and physical examination. Medical history. The healthcare provider gathers information about the patient's overall health, smoking history, exposure to environmental carcinogens, and any family history of cancer. Physical examination. The healthcare provider examines the patient, paying attention to symptoms such as persistent cough, shortness of breath, and chest pain. Imaging tests. Chest X-ray. A chest X-ray is often the initial imaging test to identify abnormalities in the lungs. CT scan. Computed tomography. A CT scan provides more detailed images of the lungs and helps determine the size, location, and extent of the tumor. Biopsy. If suspicious areas are detected through imaging, a biopsy is typically performed to confirm the presence of cancer. There are different biopsy methods. Fine needle aspiration, FNA. Biopsy. A thin needle is used to extract a small tissue sample from the lung for examination. Core biopsy. A larger needle is used to obtain a larger tissue sample. Bronchoscopy. A thin, flexible tube with a camera is inserted through the nose or mouth to collect samples from the lungs. Pathology and histology. The collected tissue samples are sent to a pathology laboratory where they are examined under a microscope to determine the type and subtype of lung cancer. Staging. Once lung cancer is confirmed, staging is performed to determine the extent of the disease. Staging involves evaluating the size of the tumor, its spread to lymph nodes, and whether it has metastasized to other parts of the body. Lung cancer staging. Staging is a crucial aspect of understanding the extent and severity of lung cancer. It helps oncologists determine the most appropriate treatment plan and predict the likely prognosis. The staging system for lung cancer involves evaluating the size of the tumor, its spread to lymph nodes, and whether it has metastasized to other parts of the body. The most commonly used staging system is the TNM system, which stands for tumor, node, and metastasis. Once the tumor, node, and metastasis categories are determined, they are combined to assign an overall stage, often expressed in Roman numerals from 1 to 4. Stage 1. The cancer is localized to the lung and has not spread to lymph nodes or other organs. Stage 2. The cancer is still localized but may have spread to nearby lymph nodes. Stage 3. Cancer has usually spread to lymph nodes in the mediastinum, and it may involve nearby structures. Stage 4. Cancer has spread to distant organs or parts of the body. Treatment options. 1. Surgery. Surgery involves the removal of the tumor and, in some cases, nearby lymph nodes. It is a common treatment for early-stage lung cancer when the disease is localized and has not spread extensively. 2. Chemotherapy. Chemotherapy uses drugs to kill cancer cells or stop their growth. It is often employed in various stages of lung cancer and may be combined with other treatments. 3. Radiation therapy. Radiation therapy utilizes high doses of radiation to target and destroy cancer cells. It can be used as a standalone treatment or in conjunction with surgery or chemotherapy. 4. Targeted therapies. Targeted therapies focus on specific molecules involved in cancer growth and progression. These therapies are particularly effective against certain types of non-small cell lung cancer. In conclusion, lung cancer poses a considerable health challenge, but advancements in diagnosis and treatment offer hope for improved outcomes. Understanding the types, causes, symptoms, and available treatments is crucial for both prevention and effective management. If you or someone you know exhibits symptoms or has risk factors, consult with a healthcare professional promptly for timely intervention and personalized care. Like this video and subscribe.